During public health emergencies, it's very important for communities to understand the problem. Because once communities understand the problem, they're able to engage and engage meaningfully. And that engagement helps science to flourish, because then communities support the science.
I'm a pediatrician by training. When we practice medicine by the bedside, you really want to have evidence for what you're doing. When you give a child oxygen, you want to know how much you're giving them, for how long, and when it's okay to stop. You can only make those decisions if you do clinical trials. Before we even do a study, we sometimes engage with the community and get their opinions about what we're going to do. We had a week where, 12 participants were due to come for a visit, and then only a fraction turned up. Immediately that's alarm bells, because that hadn't been happening for the months prior to us starting. So we went to the community liaison group and said, look, there's a bit of a problem here, people are not turning up. We've spoken to our field workers and they think then they're a little bit worried about their babies having blood taken.
Mimi ni mmoja wale walikuwa naamini kwamba KEMRI ni watu wabaya sana, kutokana na matukio ambayo labda yalitokea huko nyuma. Nimeishi nikiamini hivyo. Wengi husema ni kingi, wanasema amekuja mtu wa KEMRI akamtoa mtoto wangu damu chupa tele. Sasa unaona ile chupa, akija akiona ile damu anaona chupa imejaa.
We went through a whole list of activities about how do we actually improve the experience of taking part in that study for the participants. How do we make it a more positive experience? How do we reassure them that everything we're doing is okay? So we changed what we were doing. We changed how we were passing on the message by demonstrating using syringes, exactly how much blood we were going to take, explaining and reiterating how safe it was and where that evidence came from.
Lakini kwa hii nafasi niliyopata kwenda KEMRI ndo nilifundishwa na nikafahamu kumbe ile chupa inapokuja kuchukuliwa ile damu huwa kuna liquid iko pale ndani ambayo inaitwa blood culture. Kwa hivyo mwishowe yote inakuwa red na mtu anaona inaweza kuwa damu kidogo tu, lakini mtu anaona damu imejaa chupa tele. Sasa watu wanakuwa na taswishi hiyo.
Based on just one day of 10 people not turning up. A whole set of activities were set up where we went out to the community again and started having barazas and speaking to community members and representatives about what we're doing and trying to get from them what their concerns were and what might be leading them not to turn up.
Manake wanatusikiza kweli, tunayafundishwa tukiyapeleka, lakini wanatamani angalau siku moja tutembee na hawa wanatafiti nyumba kwa nyumba, wakazidi kuwaelimisha na wajue kweli sisi nasi ile huduma maana tupatia je tunaifikisha ama tuifikisha.
The decisions that we're making are because of direct feedback of what we see from our participants within the community. It affects us every single day. Clinical trials really fits in with our mission in terms of we want to conduct studies that are immediately translatable, that change what we do at the bedside when we're looking after children or within the communities when we have unwell children.